tell me, before we start, how have you guys been? Anybody would like to unmute and share? Nobody's talking today. Amitji, how have you been?
Good, very nice.
That's great. That's great. That's great. Kavita ji, how have you been? I can't hear you, Kavita ji. You're on mute. Okay. How are you, Mukta?
Yeah, it's been good. I mean, post-treatment, it was a good recovery, definitely. I mean, fortunately, there was no problem after my surgery, after my chemos, and obviously after my radiation. My skin was perfectly all right. That was all by God's grace, and of course, because of doctors. But yeah, now mentally also, I'm little, I find myself little bit stable than what I was during my treatment.
Wonderful. It's very good to hear. Very good to hear. So, guys, let's begin our talk today. And of course, we have our very, very beloved Dr. Dandekar, who's going to be doing our talk today. Of course, he is a man who needs no introduction. And I'm sure that kahin na kahin, at some point in our lowest possible points, he has been the guiding light, he's been the savior, and he's been supporting us through the whole journey and even beyond that. And I can say that for myself also, that he's been a very, very important integral part in making this support group happen, helping us month after month, year after year, possible for us to reach out to more patients and to be connected with you. So over to you, Dr. Prasad.
Thank you very much, Mazabeen, for that wonderful introduction, flattering introduction, I think.
All true.
These are the things that, of course, motivates us to do more. And you're right. One of the approach that we have taken in our institution right from the beginning is we're not here to sort of deliver the treatment to our patients, whether it is surgery, radiation, or chemotherapy. We are here to support the patient through their journey and help them to get better. So that has been our approach overall. So I thought this was an interesting topic because many of us either have gone through this journey or are in this journey, and everybody goes through a different journey altogether. You know, people say that, oh, we are all in the same boat, but we are actually not in the same boat. We are in the same storm with different boats, and everybody has their own different problems. So I thought it would be a nice idea to talk about it. And I want to ask before I begin that what are the challenges that some of you have faced when the cancer was diagnosed? Would somebody like to share what they went through?
Hello. Hi, Dr. Dandekar. Hi,
Hi.
2017, I was diagnosed with small cell carcinoma, bladder cancer, So in the beginning, of course, first 3 days, we were shattered. And not because of the cancer, but because of the pain you have to go through in the cancer. And in my family, a lot of people had gone through cancer. And I have seen them the way they were suffering. So that scared me more rather than a cancer. But after 3 days, I said, no, I have to accept it. I have to move on. And I had a tremendous support from my doctor, from my family, from my friends. But it's definitely very tough when first you are diagnosed with the cancer, and especially for very bad cancer, when there are no chances of surviving, when you have to go through a lot of things. So that really helped me. But I still feel scared, doctor, of that one point. If it will relapse or anything, the pain you have to go through is tremendous. We are trying everything, to survive. We are trying everything with the good diet, with good everything. But still it scares you. Okay, what if the relapse will come? It's very painful because I have seen in my family 3 people suffering like hell at the last stage, last particularly for 2-3 months.
Yeah. So yes, the fear is, I think, universal. What you are experiencing is the fear of the diagnosis, the fear of also the unknown of what will happen going forward. Will it recur? Will it not recur? If it recurs, what sort of problems will it give to me? And these are some of the common themes that come with the
Yes.
diagnosis. And many patients then go through a journey which is very sort of nicely summarized by Elizabeth Kubler-Ross. She was a psychologist. She's written a book on death and dying. It's called Death and Dying, but it's primarily applicable to any grief, anything that happens to us which causes a lot of grief. So, and I thought it would be a nice idea for me to highlight some of those things that the patients go through when we have a cancer diagnosis. So, the first step which most people face is denial, and which I see so very often. The challenge that we have in the clinic is the patient comes to us with a CT scan or a PET scan and a biopsy, which says, this is the cancer, and the cancer is involving bladder or cervix or breast or whatever. And many people have this reaction that maybe I don't have cancer, this is a mistake. Maybe the doctor made a mistake. Maybe my sample got mixed with somebody. I should take a second opinion. So there's a lot of denial as a starting point. And denial takes its own time to sort of come around. I've seen patients who will take a lot of time to come out of denial. Even towards the end of the treatment, they are still saying that you are treating me unnecessarily. There's no need for this treatment. I don't have cancer. While most of the patients then move on to the next step, which then is rather difficult to manage, which is anger. You feel anger. Why do I have this cancer?
Yes.
What have I done wrong to get this cancer? Why am I suffering like this? So, and then, we see patients who would say things like that, but I haven't smoked ever in my life. I haven't even eaten any wrong sort of food. I exercise every day. Now, why do I have this cancer? What have I done wrong? So that becomes an anger thing. And then that anger may manifest into many things. It may manifest as anger with themselves, anger with their family members, anger with their healthcare professionals. And we do see patients, especially in the beginning part of their journey, who even we struggle to manage because they're so angry. It's very difficult to care for people when they're angry. As a family member or as a healthcare professional, it becomes really very difficult to manage. The next step that comes is where, which Elizabeth calls it as bargaining, where you start bargaining, like maybe, we can do little bit of chemotherapy, but not radiotherapy. Can we do just the surgery and not do anything else? Or can I get half of the treatment and not the rest of the half so that the cancer disappears, but I don't have side effects? And many bargainings like this that goes on in our mind, that this is a step where you're short of acceptance of your diagnosis and treatment. So patients start then bargaining with themselves, bargaining with the family members and doctors in a way that, if this happens, then I will do that. If that happens, then this will happen. So it's a sort of a conflict that is going on. Many of them, then they realize that actually this is not working. And they realize the futility of this anger and this bargaining. And then that's a phase where some people feel maybe depressed, that they sort of then feel hopeless, that I do have cancer, I do need to take this treatment, and depending on the stage and everything, I may get cured or I may not get cured. And that then causes depression. And this is a very, very difficult phase where the patient needs maximum support, where we need the doctors, all the other healthcare professionals need to step up, especially mental health professionals do need to step up, like Mazabeen, and we need the family members to step up. I often see patients, family members, they are so tired and fed up. They said that I'm doing everything that I can for my mother or my partner or whatever, and they are just not willing to fight. I want to fight. I'm supporting my partner to fight, but they are just giving up. And that's because they're going through this phase of feeling so low because of the diagnosis and the whole perceived hopelessness. It may not be a hopeless situation. We see patients who are completely curable, very early stage laryngeal cancer, very early stage breast cancer, completely curable, but they still feel that hopelessness. And finally, patients then move on to acceptance, which is a phase where things start falling into place, where they say, okay, I have this cancer, this is a treatment, I have the doctor, and now I have to move on. So in some patients, all of this may happen in just first few days. Some patients, it may take weeks, months, or even years. Everybody has their own different journey. The question is now, how do we manage this? And that's what I wanted to speak to all of you, is the overcoming the challenges that we face during the diagnosis and treatment. So here the first point is that we need to have a support structure around us. Whether that support structure is your family, whether that is your family of choice, which means that your friends and your network around you. It also means that your healthcare professionals. So healthcare professionals will involve your diagnosticians like radiologists, pathologists, your oncologist, so medical oncologist, radiation oncologist, surgical oncologist, and all other doctors that you would need. And this is very important to choose the right doctors. And the right healthcare professionals are not only dependent on the qualifications that the healthcare professional has, of course, that's very important, but also how comfortable are you with the doctors? How comfortable are you with the hospital, for example? How comfortable are you with proximity? Like suppose if you're staying in Navi Mumbai and you have found a doctor in, say, South Bombay. Is it possible for you, the logistics of possible for you to travel all the way and then meet the doctor? So all of this needs to be considered. But finding the right medical team is a very critical point in this. And I want to emphasize the importance of the team here. I'm not saying find the right doctor. I'm saying find the right team, because your oncologist is not going to be the only person who's going to deliver your treatment. You will need, say, for example, gastroenterologist, speech therapist, physiotherapist. You may need somebody like Mazabeen for your mental health support. You may need a psychiatrist, a yoga therapist. There's so many people involved in your care. So you need to find a good team to support you in this journey. So that is an important step. I want to ask at this point here, what are the challenges that you have faced while deciding your healthcare team? What are the problems that you face? And accordingly, I can maybe give some suggestions about how we can choose the right team.
Yeah, hi, Dr. Prasad. This is Vidya here.
Hi, Vidya.
Though I had a proper family support from my mother or my husband or in-laws, whatever it is. So proper support was there. I never heard somebody is telling that they're fed up or they are losing the hope or anything. But as I had two small children at home, after getting all the support from others, I was having this guilt feeling that I'm not able to take care of them when they're in need, because my son was just 4+ and daughter was around 8 years. So that is a mental trauma, or that was a stress which was internally I was struggling. So maybe if you can put some light.
Yeah. So this is a common dilemma which we see. So a young mother may feel, I'm not able to give time to my children. A husband may feel that I'm not able to give time to my wife and my family, or somebody may feel that because of me, my children are suffering because they cannot go to work and they have to spend money. So all these dilemmas do come up in our mind. What I feel at this point is that we need to focus on the final goal. What is our final goal? My final goal, for example, in your case, could be I need to get better very soon so that I can be there for my children. If that means that for next few months, I may not be able to give my 100%, that's okay. This is this is the this is the choice that you will have to make. I do see patients who would say, you know what, I don't want to inconvenience my children. Hence, even though I have curable cancer, I don't want to take treatment. And then I speak to these patients and I tell them that what you are doing is a very selfish thing. You may feel that you are being selfless, that I don't want to trouble my children. But what you're doing is very selfish because you are denying the joy of having a mother to your children. If you don't take the treatment and if you fall very sick, then they will have to care for you. Even if you say that they don't need to, they will. And God forbid, if something serious should happen to you, they are going to lose their mother. And that is not a nice thing to happen. So we need to think a bit long term and look beyond what is impacting us. So I would invite here is to think about when my daughter from 8 year today becomes say 16, if I'm not there, what will happen to her? So I need to be there for her. And in the long term, so suppose if your treatment is going to last for 3 months, in next 3 years, you won't even remember those 3 months, how they went. Because if you look at the long-term perspective, the time that you spend in the treatment is going to be much shorter. So we have to, while these questions come to our mind, they're very valid questions. We have to put them in perspective of long-term goals and then deal with them. Also think about the consequences, that if I don't do this treatment well, or if I continue to feel guilty about doing this, then what impact will it have on me in long term, as well as on my family on long term? And here again, in open dialogue with the family. You sit with your family and talk to them. I mean, of course, children 4 and 8 are too young, but maybe with your partner, maybe with your in-laws and your mother and parents, where you discuss these things out. And that's where I feel an open communication between the family members is very important. Very often I do see family members coming to me saying, doctor, don't tell the patient that they have cancer, or don't tell them that they have advanced stage cancer. It's very common in India for the family members to say, tell the patient that they have some swelling. Don't tell them that they have cancer. If you tell them they have cancer, they'll give up hope. Now, I personally feel that is a very bad approach, because the very fact that the patient is coming to the hospital, you're bringing them to see an oncologist. Most of them know what's happening. But what happens is, if you stop that communication, that I will not talk about this treatment with you, what you are saying is, yes, you have a problem and I will not talk to you. So the patient has nowhere to go. Patient feels that my family member is lying to me. They feel that possibly their doctor is lying to them. So they feel terribly lonely. And that is a very wrong thing to do, in my opinion. I think we all need to support the patient. You don't have to maybe blast the whole truth at one go, but breaking the news down. So, for example, if suppose an elderly lady gets diagnosed with an advanced stage breast cancer, we can start with, okay, there is a lump in the breast which needs to be treated. Maybe we'll need, surgery. Maybe we'll need some more injections, and gradually we build up. But if you completely hide the fact from them, unless you think that your family member is completely unable to comprehend what is happening to them, they are going to feel lonely. See, if you are going to get fever, your body knows, right? You feel, you would say, I'm feeling a bit feverish today, maybe I'm going to get fever, and then 2 hours later you have 102 fever. So your body is always telling you what's happening. So imagine what's happening to a cancer patient when they have that thing in their body, or they are taking treatment. Of course their body is going to react. So if you stop talking to them, that's going to close down the conversation and actually going to make things very difficult for the patient. Anyone else wants to share what are the challenges that they faced when they were diagnosed with cancer? What are the problems that they faced?
Hi, my name is Prachi. I am 30 years old, and this is the first time I'm attending this meeting. This my therapist recommended it. I was diagnosed with squamous cell carcinoma, vulvar cancer, essentially, in in February end, and I had to get surgery on the first to remove it, and it was successful. Thankfully, all the margins were clear, and my lymph node biopsy test was also clean, and I'm still not sure if I'll be able to communicate this properly. Please bear with me if I fumble a little bit. I feel like my problems, or the biggest obstacles that I faced mentally during this phase, was making sense of it myself. I My operation was on the 1st of April, and thankfully it was caught at a very, very, very early stage. My oncologist said, I think stage 0, he said. And I feel like by some stroke of luck that happened, that was caught early, but the surgery still changed my body quite significantly in ways that I am still trying to understand and accept. And I still feel like it's been almost 3 months now since the surgery, but I still feel like it was not real, or like I feel like what happened was not real somehow. It feels very surreal that this happened. Mainly because of how rare my oncologist said this kind of cancer is, especially in somebody of my age. So I did relate to quite a few of the things that you said, doctor, about why it's happening to me. What have I done to sort of cause this? And I'm at this phase, I think I'm just trying to make peace with the fact that I will probably never have these answers.
Thank you, Prachi, for sharing and joining us today. And yes, you are not alone in this journey. Many of us will really struggle with those answers, and not just you, your doctors also will be sometimes baffled that why is this patient having this particular type of cancer? We don't have those answers. But what you brought on was the difficult part, which happens after the surgery or after the treatment, which is the treatment is done and things have changed. Your body has changed. And that is, what I like to call as adjusting to new normal. Now, if you put things in perspective, you see that, continuously we are aging. Of course, every day we are aging. I'm 45 now. If I say that, okay, I want to feel like when I was 35, that's not possible. I want to do things at the pace that I was doing 10 years ago. That's, of course, not possible. But because aging happens very slowly, we have ample time to adjust to it. And also, aging is normal. Or rather, I would not use the word normal. Aging is also something that everybody goes through. So it is a well accepted sort of a thing. What happens with many of the cancer therapies is that the change is sudden, and it's also sort of dramatic. It's not a subtle change. Say, for example, somebody has tongue cancer. and they undergo surgery where partial tongue is removed. So they may not be able to eat normally, they may not be able to speak normally. So overnight, literally overnight, this change happens. And then this becomes a very difficult change to accept. Somebody may have a vocal box cancer and the entire vocal box is removed. So from somebody who was able to speak yesterday, today you just have a hole here and you're not able to speak. So because these changes are very sudden, they become very difficult to adjust to. But we have to look at them maybe slightly differently. And of course, be compassionate to yourself and allow time. You have to allow time to sink in these changes. And we have to gradually accept that this is my new normal. And how can I make most of this new normal? So, all right, I'm not, I actually missed which part of the body your tumor was. Can you just tell me again, please?
It was vulvar cancer. It was on my labia.
Labia. Okay. Okay. So say, so you may have undergone surgery where the private parts would have, altered now, and it creates problems with many functions which we take for granted, whether it is say urination or sexual function, or even simple things like walking, for example. If there's swelling, it may become difficult. So at this point, of course, it takes time for the body to settle down. So after the surgery, it may take 2 months, 2 weeks to 1 month for the body to settle down. And then simultaneously, we have to let our mind cope with it, this new normal. And then the question is, what can I do to do best with this new normal? Rather than how can I go back to normal, if we can change that question, how can I go back to normal, and change that question to what can I do to get best out of what I have today? And here I think a sense of gratitude, which we often, most of us, have lost track of. A sense of gratitude is very important, where I would say I had cancer, but I'm grateful that I have the resources to meet the doctors and get the treatment done. And here I am today. I have changes in my body. Now, what can I do to make most of it? Do I need physiotherapy? Do I need medications? Do I need just time? Do I need any other form of support? Do I need to talk to some counselor to deal with it? And when you put all of this together, that's when the adjustment to the new normal will actually gradually come through. That change also takes time. It's not sudden. So, for example, if somebody has had undergone a mastectomy where you remove the breast completely, it's something that is glaring in your face every single minute of your life. But with time, with these adjustments and a sense of gratitude for what we have rather than what we have lost. So sense of gratitude for what we have rather than a sense of loss is something that really I suggest something that we need to inculcate in our mind. And that will help in these problems. Anybody else would like to share what are the challenges that they have faced in diagnosis and treatment?
Hello, doctor. This is Mukta Kulkarni. I had breast carcinoma, grade 3, and now all my treatments are over, like chemotherapy and radiation. Now I am on one oral medicine that is called Bracanat, because my BRCA1 was positive. It was genetic. It was supposed to be genetic cancer, I would say. So just to avoid my like reoccurrence of cancer, maybe in uterus or ovaries, there is one tablet is prescribed. Now, because of that tablet, I'm having severe acidity. I mean, I just can't do anything if I take that medicine. I cannot eat anything. I have burning sensation in my stomach, in my chest, even in my throat. It is very bad. So my oncologist, Dr. Advait Gore, has reduced the dose, and after that, I'm feeling better. But I just want to understand from you. I mean, uh, is there any any particular dose is meant for my age or my kind of cancer, or now I had 4 tablets a day, and now it is reduced to 1 tablet a day. So 1 tablet is absolutely manageable. So will it continue? Is it okay to continue 1 tablet a day? And I don't mind taking for 2 years also, but 4 tablets I just cannot tolerate. Chemos were much easier for me than this, oral medicine.
Yeah.
So can you guide me on that?
Sure. So, Mukta, I will not go into the details of the specific medication at this point because I will need to put that into context. But what I would like to bring in here is a very important point that you're making, that your oncologist has suggested a particular medication, and that medication in the suggested dose is not agreeing with your body. And what you are doing, I think, is the right thing, is where you are having a dialogue with your oncologist, and your oncologist is then titrating the dose. Many patients, what they do is they try something out, they try the medication or radiation or whatever, and if they feel that this is not working, they just give up and they stop the treatment, and that has very serious implications later on, and that can cause complications. So what you're doing is right. We have to respect our body, what our bodies can take and cannot take, and we have to deal with it. What has happened is, while the medications for cancer have improved, also the medications to deal with the side effects of this cancer have also significantly improved. So your oncologist may prescribe you some other medications to take care of this acidity issue. You can also then look at other aspects like what are the diet, what are the habits, and other things, and have a conversation with your oncologist on building up your resistance for the side effects of this medication. So these are the right steps to take, that listen to your body and see what can be done to improve the tolerance. Also, I want to bring in a very important point here for everyone to ponder on. Every decision that we take, whether to take the treatment or not to take the treatment, has to be based on risk versus benefit ratio. I personally, when a patient walks into my office, the first question that I have in my mind is, do I need to treat this patient? Can I avoid treatment? And now, because I've been doing it for so many years, it almost become automatic in my mind. I was like, okay, but these are the factors which make this treatment important for this patient. And if I don't give this treatment to this patient, the risks are very high, and the benefits are low. But if there are times when I see a patient where I feel that there is some benefit, but the risk is so high of delivering the treatment that I would rather not treat this patient. Similarly, when you are taking a decision to start the treatment, you have to weigh this in your mind, risk versus benefit, and your oncologist will tell you what are the risk versus benefit. And if they haven't told you, please go and ask your oncologist. Doc, if I take this treatment, like for example, radiation, for example, if somebody comes to me for radiation for, say, tongue cancer, then I would explain them that you've had surgery, but I'm suggesting radiation because of these 4 factors. For example, the tumor is large, deeply infiltrating, lymph node positive, extranodal extension, whatever those could be. And if you don't take this treatment, the risk is that the cancer may come back, and there is a higher chance that the cancer may come back. So the benefit of this treatment is higher and the risk is lower. So you should take this treatment. So we need to have that conversation with ourselves and take decisions based on data and sort of not make these decisions very emotional, because emotions will only look at short term. Emotion will tell you, what am I feeling now, and drive the decision, which can be actually harmful. The decision should be ideally taken on the basis of what is good for me today and what is good for me in long term. And for that, you will need data. So that data you can ask your doctor. Doctor, if I take this treatment, what are the benefits? What are the side effects? How will you manage the side effects? What will happen to me in long term? So these are the questions that you should ask. So when you visit a doctor, please go with a list of questions so that you get answers to all your questions. I really love patients who ask me questions. I'm very scared of patients who have no questions, because then I'm like always worried that if I tell them whatever information I have to, but if something else happens to them, then they will come back to me saying, correct, but this is unexpected. So I like patients who ask questions. So please go to your doctor and ask questions. Yeah. I think Sandeep wants to ask a question.
Yeah, Dr.
Sandeep.
Prasad, thank you very much for the program today. And I'm very happy that you say that I like patients who ask questions, because we have got sometimes very bad experiences that, the doctors don't tell us anything. They don't want to tell us anything. But of course, some of the doctors are really patient friendly. Now, my question is that I had the colorectal cancer 2.5 years back, and with your radiation treatment and surgery after that, and a chemo for non-recurrence, which got over, and till now I am absolutely hale and hearty. There is no recurrence. I get it checked every 3-4 months. I wanted to ask you that I have been recommended to do CT every 6 months for the rectum part, and also the liver function test, because this cancer can spread into liver or lungs. I mean, the most likely. Somebody told me that the liver function test, blood test only, like, will not be able to tell you whether the cancer is there in liver or not, because it's only in the initial stages. It doesn't come in the blood. So is it advisable for me to even do the CT for the abdomen, or I have been told only to do LFT blood test and the CT for the colorectal.
Thank you, Sandeep. So you bring us to the next section, basically, which is what happens and what are the challenges that patients face about the follow-up. Now, the treatment is done.
Yeah.
And now there is a little bit of a confusion as to what happens next. So talking about your specific condition, yes, if there is a little chance, fear that we have that colorectal cancers can spread to liver. And liver function test is, while it is important to do the liver function test, because if you have a huge burden of cancer in the liver, it will derange your liver function test. If it is an early start of the cancer spreading to liver, it will not reflect into liver function test. So for that, you can either do a CT scan of the abdomen as well, along with CT scan of the pelvis, or you can even do a sonography of the liver, sonography of the abdomen. Sonography is actually far better at looking at liver lesions than even CT scan, if the lesions especially are small. So you can continue doing your CT scan of the pelvis and add a sonography, or you can do the CT scan. I would here again request you to take an opinion from the oncologist that is on regular basis following up with you. I mean, you are following up with them.
Yeah.
And take their opinion as to what would they prefer. But the important thing here, and I want to congratulate you on that, is you have already crossed 2 years, right?
Yes.
Now, 2 years, first 2 years are critical for most cancers, because we do see that majority of the recurrence, if they were to happen in the first 2 years. So if you cross the barrier of 2 years, that's great. You're already sort of, we would call cancer free. So,
but I think I will continue for 1 or 2 more years, just to be safe.
Absolutely.
Today, thanks to HN Reliance, I am absolutely hale and hearty, enjoying life. It was stuck to me, and it was all taken out with all the 3 radiation, the same protocol which I followed: radiation, operation, and chemo. And touch wood, I'm doing wonderfully well. I've regained all my lost weight and doing everything in life what I was doing earlier. But I only want to make sure that, if it doesn't come again, though I am on no medication, zero medication since last 2 years. But even the food point of view, I have no restrictions. I am only controlling something which is all in limit. So, of course, I am a non-smoker and non-tobacco person. So that is only one good advantage.
Very nice.
Yeah.
So I'm really happy to hear from you, Sandeep, that the treatment has really worked for you.
Yes.
And that you're doing well. So continue this, and inshallah, we'll never see any recurrence in your case. I want to just bring in some of the new faces or other names that I'm seeing here. If they want to share something, I see Aniket here, and which is the other name, which is a new name. I think Aniket is the only person who's new, and I can see my cousin Avdut also is here. So Avdut, if you also have any question, please jump in and ask. So any new members want to ask any questions or make any observations?
Sir, I want to ask one thing.
Yes, Amitji.
Sir, almost 3.5 years are over till I finished my chemotherapy and radiation. I did not go for surgery. And my doctor had told me to do endoscopy and PET scan every 6 months. So far, everything is good. Now, can I extend that period, or how soon is it advisable to do PET scan after like more than 6 months, or after, if I do after 9 months or 1 year, or I should continue to do it 6 months?
I think, Amitji, because I know your case very intimately, I would recommend that you continue at 6 months. And I want to bring in the point here is that depending on the risk that the patient has, the oncologist will also decide what is the frequency of investigation. So I suggest in your case, let's keep doing it at 6 months to just keep a closer watch, because we know your treatment has been slightly lesser than what we anticipated it to be, because the surgery is not done. I think I don't know the name, but there is a person called JLK. Do you want to ask any question?
Hi, Doc. I'm Jyoti Karmakar.
Oh, yeah. Hi.
Hi.
Karmakar.
Yeah. Well, it is the first time that I've joined the weekend program. And I must say that reading your name, I was very excited. I said, Dr. Saab baat karne wale hai. Okay. So what I would like to say is that it becomes difficult for people like me, to wait. Kitna din baki hai. So I've finished 5.5 years. It's going to be 6 years in October. And the medication that I'm taking, it's 14 days on and 14 days off. And it's working well. And hopefully everything will be good. But I always like to ask myself, kitne din baki hai? Like how Gabbar used to sing, kitne aadmi the? I keep asking myself, kitne din baki hai?
So when you say kitne din baki hai, you mean kitne din baki hai of what? Of the treatment?
Yes, and myself being happy-go-lucky. Because I've heard a lot of people have a lot of problems when they stop the, treatment, and then all the pains and aches and everything starts. So it's just that, it's not that I'm waiting for something to happen. It's just that I'm hale and hearty. But the only nagging feeling is that, okay, how do you calculate how long you can take the medication? And that's a big question I've had since the last 3 months. I'm doing pretty well, and I'm hale and hearty, enjoying life. But kitne din baki hai?
So Jyoti, I'll split the question into 2 parts. How many days are left for the treatment? Now, the treatment part is fairly standardized. So your oncologist will again tell you how long do you need to take the treatment. And most often that is not based on how the oncologist is feeling today. It is based on what we call as evidence-based medicine.
Right.
So what that means is the oncologist is going to look at all the data that is available of thousands of patients treated before you. And there are multiple clinical trials that are done where say they gave the medication for 5 years and 10 years, and they checked, which group of patients is doing better. And they may say, okay, 10 years is doing better, so we should give it for 10 years. So as far as the treatment is concerned, your oncologist should be able to tell you for how many months or years you need to take the treatment. So that's something that you need to check. And again, this is highly customized. So it will
Right.
depend on your age, your general condition, other comorbidities, the drug that you're taking, the average life expectancy your doctor thinks that you have, and everything else. So there are so many factors that your doctor will decide. So most of the time we don't understand this process that happens in our head. Like, for example, if you come to me and you ask me, doc, how many days I need to take this medication, I will have a algorithm run in my head, looking at you and your reports and all the data and the evidence, and I will give you an answer. What you will see is Dr. Prasad wrote a medication, okay, you take this for 5 years. But a lot happened in my head before that. So when we advise any treatment, it is evidence-based, and you're most welcome to ask your doctor that why are you telling me that I need to do this? Why these many months? Why these many years? And your doctors will answer those questions for you. As far as the second question is concerned, how many days are left of my life of enjoying life and being happy-go-lucky? Well, you have today,
Absolutely.
and that's a great gift.
True.
Today is a good day.
Absolutely. I agree.
And I think we need to build in this sense of gratitude, that you wake up in the morning and you feel, okay, what am I going to do today? I'm going to go a little off track and share something which some of you might find very weird, but I think I want to share that. So I have wondered for years as to what is the purpose of life. Why do we exist? And then I came in contact with many books which are written by Dalai Lama. And he has a very nice concept that the purpose of life is to be happy. And I read many of these books, and I sort of probably forced myself to believe that the purpose of life is to be happy. But I never sort of bought into that idea completely. Few months ago, I had gone to Malaysia to visit a very dear friend of mine, and we were on this beautiful Penang Island. And post lunch, I was having a nice massage, and then there I am, like lying down on the massage table. And then suddenly, I started thinking about this, and I, at that point, probably felt, and this is completely my opinion and my thinking, it's nothing to do with reality. I felt that actually there is no purpose to life. Like, the plants are growing in the jungle, and, other animals are, reproducing, and there's no purpose to life as such. You are there because maybe your parents chose to have you. The purpose could be like, for example, your parents may thought, oh, if I have a child, maybe the child will support me in my old age. So that is a purpose that has been given to you by your parents. But by default, I feel that there is no purpose to life. And that was very liberating, because then I said, if there is no purpose to my life, then I can choose. I can choose the purpose of life. So every day in the morning, I say, there's no purpose to my life, and hence I choose to be happy today. I was having this conversation with Dr. Vineet, who's a part of my team. I can see him also on this call. And he said, but how can you be happy every day? And I said, I'm not a maniac. I'm not a psychopath that I'm happy all the time, like smiling. No, but there are phases. You feel happy, sometimes you feel down. But overall, what is the mood that I have is happiness. And he said, but how can you feel happy? And I gave him an example. I said, yesterday, I saw a patient who came to me a few months ago on a wheelchair. in a terrible state. And yesterday she came to me walking, and she was so happy and she has recovered so well. It gave me immense joy to meet her, just to meet her. Forget about the cancer, I don't care. Just to meet her. And I think that is my purpose of life. I want to be happy. And to achieve that happiness, I have probably become an oncologist. And it's a very liberating thought. So I don't really count days. I really don't think about, I mean, of course, we have to plan for future. It's not that you say, okay, kal jo hoga dekha jayega. You have to plan for the future. But building that gratitude for the day that you have today with you, I think is a really, really nice practice. And I invite all of you to do it.
I'm really happy for every moment that I have, and I've had very supportive people. And I also must say, you have told me that you look out of the window and look at the birds and the leaves and all that, you know. And I said, yes, I do get to see parakeets and bulbuls. And this morning, since it was raining, I remembered you. I said, here's the bulbul saying tweet, tweet and all that. But the long and short of it is that one has to be positive and one has to take things in their stride. And I got no complaints. Honestly, I've been very fortunate to have good docs around me. And my request to all the members who joined today is, Aaj ki baat, aaj socho, kal ki baat nahi karo, which I've done all along. But now I'm just saying, okay, even my CA 125 results have been pretty good. So I've got nothing to complain about. So thank you so much.
Thank you.
And I wish all of you happy, happy times. And my son says, how can you be happy and how can you keep saying I'm happy? That's what I am. I've got no complaints.
I want to bring in Mahzabeen on this. Mahzabeen, you are the expert on how do we feel happy and grateful, and of course the mental health aspect of it. Do you want to give us your wisdom on this?
Thank you, Dr. Prasad. And when we talk about mental health, I think first of all, it's so subjective that there's no one size fits all. But I think if there are certain guidelines, certain points to keep in mind, would be one thing is, of course, and something that I've stuck by and something that's helped me also overcome certain challenges in my life is to focus on the controllables. There are always going to be factors that are beyond our control, where we don't know what to do, how to go about it. But even in those situations, finding that one thing that I can work on, finding that one small thing that I have control over is very, very important. For example, let's look at COVID, a global pandemic, jahan pe nobody had any control. The countries were at a standstill, like abhi kya karna hai. At that point in time, as human beings, we found control that I'll wear a mask. I can't control the pandemic, but I can control how I try to safeguard myself. So even in such big, dire situations, finding that one thing, that one anchor to have that control is very, very important. The second thing is, of course, that we want to be more in the present, because that's where we have the maximum control. And of course, it's easier said than done. But what happens is that when we look at the here and now, when we are a little more mindful about our environments, about our present, what happens is that our scope of action is broadened. When we talk about anything, most of the times what happens is, as human beings, we are either thinking about the future or we're thinking about the past. Now, both the areas, we don't have a lot of action. There is no control. Past to ho gaya hai, kuch nahi kar sakte. And future is so uncertain, so unpredictable. Again, there's no sense of control. And wahan se, that kind of brings about that feeling of anxiety. That kind of feels, scary. And that is why the more we are focused on the here and now, the better it is. So I think these are one of the few things that we want to keep in mind. Of course, trying to have stable routines as much as possible in our lives, that even though I might be going through certain difficult challenges in my life, whether it is medical or even physiotherapy or psychotherapy related, what are the stabilities? What are my anchor points in life? And having one or two anchor points, okay, kuch bhi ho jaye, at least I have this thing in my life to look forward to. This thing is a part of my routine. This thing is something that I look forward to. Having those tiny anchor points help a lot. So I think these are some of the things that we can keep in mind.
Thank you, Mahzabeen. Maybe, Mezabeen, we should do a session, maybe the next session, on just mindfulness. I think there is so much to learn about how to be present and how to be mindful, and maybe add even a little bit of gratitude practice and mindfulness practice session. I think that would be really helpful for all of us, not just our patients, but even us. Do you think it's a good idea?
Definitely.
So
Definitely.
maybe let's
It's a
plan it
wonderful
for the
idea.
next month or something. We'll do that. Perfect. We are coming to the end of the session. Any other questions or queries or comments anyone has?
So I don't have a question right now. I just wanted to add to whatever you or Dr. Mezagin has said. Like, not as a cancer patient or a cancer curer or a cancer survivor, but as a human being in the today's world, it's so uncertain. We hear a lot of things like young, boys getting or girls getting heart attack, or there's an accident, and a lot of things. So I think every morning, if we are waking up and we are able to do our own stuff, so routine, and we are alive, I think that is the reason for the happiness as of today. And those who are undergoing treatment may be facing some issues in doing their routine things. So that is just a temporary condition. That's what I want to tell. And even for cancer, what I believe, and even I tell people when I interact, is that don't take it as a disease or a things. It's just a condition which will go away once you're done with the cancer. It's not like BP or sugar or cholesterol which is going to be there and you have to take medicine for lifelong. So this is better than that. So just think in that. Thank you.
That's a very nice way of putting it, Vidya Prabha. I am going to take just a last question. Raj has asked, which test would you suggest to know that you are over with breast cancer? Raj, again, the test will depend on what type of breast cancer the patient had, what stage they had, and what was the treatment they have had. So, for example, in some patients, we would ask for just a yearly mammography. In some patients, we may ask just for sonography. In some patients, we may ask for the PET scan. Of course, clinical examination by the doctors will happen. So it really depends. But if I were to answer in a broader sense, it will be a combination of sonography, mammography, PET scan, certain blood tests. So that would be a combination of tests. So thank you very much, everyone, for joining today. And I actually barely made it to the meeting. I'm in Pune right now. I drove to Pune and I really had to rush because of traffic. I wasn't sure if I'll be home before we start the meeting. So yeah, it was a bit of an exciting morning for me. But finally, the rains have started. Thank God. So enjoy the monsoon. I will see you next month, and we will have another interesting session. I again want to encourage all of you to invite your friends and family who may or may not have cancer to join the weekend support group, and we will share interesting information on their email address or in the WhatsApp. And the idea is to spread information. Idea is to increase awareness about cancer and the treatment. So just connect them to us, and we will be happy to add them onto the list. Take care. Have a wonderful weekend and enjoy the monsoons. Bye-bye.
Thank you. Thank you.
Thanks, Avdut, for the lovely message.
Thank you so
And
much.
I'll share the YouTube link with everyone soon, so you can share that YouTube video with others. Bye.
Thank you.
Bye.
Thank you. Thank you, everybody, for joining in. And thank you for
Thank
making
you so
time, Dr.
much.
Prasad.